First of all, perhaps the Minister for Health Promotion isn't here this morning, but maybe the Minister for Health could maybe address this for me regarding the HPV vaccine and the notable decline in the uptake of it in the last year, and that the former Minister, former Minister Harney, brought this in and expected to have an uptake of about 80% in the HPV vaccine. And my understanding is that we exceeded that with about a 90% uptake. And due to various factors, including a fairly aggressive social media campaign, there has been and various claims about side effect profile of the vaccine, that we are now dropping down, and we're heading towards, we continue in the same trajectory, we're heading towards an uptake rate of under 50%, which is very concerning because it's completely in breach of the concept of herd immunity and how we could have had the possibility of eradicating cervical cancer for the likes of my young daughters. And my understanding is that the fall off in vaccine rate could translate to the actual deaths of 40 girls that are now 12 and 13, 14 years of age. That there is 40 girls in that cohort that will die of cervical cancer directly as a result of the fall off in vaccination rate. And I would like the Minister to perhaps outline how this can be addressed, perhaps. And also, I just would like to highlight at the committee this morning that the next phase in vaccination were young boys. And there's a huge rise in head and neck and anogenital cancers in men, and that the HPV vaccine was to be rolled out to boys, and young boys in this country, as a result of the impact of a campaign, are now not being vaccinated. So there's a sense of inequality there from my point of view, that boys are not getting what we planned to give them. Secondly, if the Minister could, or perhaps Minister Byrne or Minister Harris could update me on the health or the policy regarding medicinal cannabis use. There's been a lot of talk about this lately, and if you could outline perhaps where we're going with this and the time frame, because there is concern among parents in particular, or patients with multiple sclerosis, or children suffering from, or parents of children suffering from seizures, that this particular medication could assist them. And if the Minister could just outline that for me. Delighted to hear that.
Minister, are your
thank you very much.
Colleagues.
A lot there. Thanks, Deputy O'Connell. Firstly, I'm really pleased that you raised the issue of the HPV vaccine, because I think it's really important that I get to put on the public record my absolute support for this very important vaccination programme, based on all of the medical advice available to me, available to the Department, available to the Chief Medical Officer. The immunisation programme in Ireland, as you know, is based on the advice of the National Immunisation Advisory Committee, and this is a committee of the Royal College of Physicians of Ireland, comprising of experts in a number of specialities, including infectious disease, paediatrics and public health. And the committee's recommendations are informed by public health advice and international best practice. And in 2009, that committee recommended the HPV vaccination for all 12-year-old girls to reduce their risk of cervical cancer. And in September 2010, the vaccination programme was introduced for all girls in first year of second level school. There are 2 licensed, as you'll know, HPV vaccines available in Ireland, and Gardasil is the vaccine used by the HSE in the school immunisation programme, and it is provided free of charge to girls in the first year of second level school. In September 2011, a catch-up programme was started for all girls in second level school, and the 2013 and 14 campaign was the final year of this catch-up programme. And I'm very much aware of the misinformation that's out there that you referred to, Deputy O'Connell, and I'm extremely concerned about the impact that this is having on the health and well-being of our young women in this country. As you'll know, cervical cancer is the 4th most common cancer in women worldwide, and each year in this country around 300 women are diagnosed with cervical cancer, and around 100 will die from this disease. All of the cervical cancers are linked to high-risk HPV types. There are over 100 different types of HPV. But published figures for 2014 and 2015 show that the HPV vaccine uptake was 87%. This was the highest ever uptake since the programme began in 2010. So whilst I don't have final figures for the 2015-2016 programme yet, preliminary figures released by the HSE do indicate that about 5,000 fewer girls received the HPV vaccine for this period compared with the previous year. And this significant decline in uptake does vary across the country, with some western and southern counties most affected. This decline is extremely regrettable, and I am concerned that it may be related to unsubstantiated concerns about the HPV vaccine safety raised by groups. You'll be aware that information is available for parents, and I'd encourage parents to check out information about all vaccines, and the information leaflet in relation to this vaccine is available on our national immunisation website, which is immunisation.ie. This website has been accredited by the World Health Organization for credibility, for content and for good information practices, and it does allow members of the public contact the National Immunisation Office to ask questions if they require further information, and these questions, where possible, are answered by a member of staff in that office within one working day. So I really would encourage the parents of Ireland to actually access this service, have their questions asked, look at the information, and remember that the information you're being provided with on that website has been accredited by the World Health Organization. Gardasil is a safe and fully tested vaccine which protects against the main cancer-causing strains of HPV. As I've said, 300 women diagnosed in this country each year with cervical cancer. By January 2016, over 200 million doses of Gardasil have been distributed worldwide, and in Ireland, over 580,000 doses of the vaccine have been administered, and over 220,000 girls have been fully vaccinated against HPV since it was introduced in 2010. And Chairman, I want to put on the record of this committee that it's not me just saying this vaccine is safe. It's not even just evidence here in this country. We have also seen the European Medicines Agency, the EMA, an agency I hope locates in Ireland. We've seen it complete its own detailed scientific review in November of last year of the evidence surrounding reports of two conditions. There were two conditions reported: complex regional pain syndrome and postural, we won't go into that word, we'll call it POTS, which causes symptoms such as dizziness and fainting, as well as headache, chest pain and weakness. And in line with its initial recommendations, the EMA confirms that the evidence does not support a causal link between the HPV vaccines and the development of these conditions. Therefore, there's absolutely no reason to change the way the vaccines are used or to amend current product information. The agency's Committee for Medicinal Products for Human Use also looked at the issue and concurred that the available evidence does not support that C or PS or POTS are caused by the HPV vaccine, and it therefore also did not recommend any changes to the terms of licensing or product information for these medicines. And furthermore, on the 12th of January this year, the European Commission endorsed the conclusions of the European Medicines Agency that there is no change to the way HPV vaccines are used or to amend current product information. This final outcome by the Commission is now binding on all member states of the European Union, and the review recognised that at the time more than 80 million girls and women worldwide have now received these vaccines, and in some European countries they've been given to 90% of the age group recommended for the vaccine. Use of these vaccines is expected to prevent many cases of cervical cancer, cancer of the neck of the womb, which is responsible for over 20,000 deaths in Europe each year, and indeed various other cancers and conditions caused by HPV. So the benefits of the HPV vaccines are well known. They're well endorsed, not just domestically, but internationally, and they are now binding, as I've said, on member states of the European Union since the European Commission looked at this issue in January of 2016. The safety of these vaccines, let me assure people, obviously will continue to be carefully monitored, as is the case with all our vaccines, and will take into account any future new evidence. But I'm really genuinely very concerned about the much lower uptake of the vaccine this year based on preliminary figures than last year. This will result in people dying of cervical cancer, a cancer that could have been prevented were people vaccinated. And I would encourage again parents to check out the medical information available to them, the expert information and the information endorsed by the WHO on our website, immunisation.ie. I'd like to see the expansion of this to boys, and I'll ask that we come back to you, Deputy O'Connell, with plans in that regard. In terms of the National Maternity Strategy,
medicinal cannabis.
Yes, you remembered as well. Obviously, my colleague, the Minister Catherine Byrne, has responsibility for our national drug strategy and issues in relation to drugs. In the whole sense, obviously, will be dealt with in that strategy, and I might ask Minister Byrne to come in on this, but just from a medical point of view and from my areas of responsibility within the department, just to provide an update to the committee, I think will be quite important. I have been, as I know, members of this committee and members of all of the heads of the Oireachtas have been contacted by many patients in this country who have a strong belief that medicinal cannabis could provide them with significant pain relief, or perhaps even more than pain relief in terms of allaying their symptoms of some very, very serious conditions. And I know there was a briefing here in the House of the Oireachtas yesterday by Deputy Gino Kenny on a bill that he proposes to put forward. I also had a meeting yesterday with Ms Vera Toomey, who has been advocating for this change based on her own daughter's medical conditions, Ava Barry. So what I decided to do last week was to initiate a policy review of Ireland's policy in relation to medicinal cannabis. We have to be led here by the evidence. I instinctively would like to see a policy change in this regard, but it has to be evidence-based. It has to be based on best international practice. We must follow the clinical and scientific evidence. So I have asked the body that is available to us in terms of clinical and scientific evidence, the HPRA, formerly the Irish Medicines Board, to do a body of work and to report to me in January of next year on their views based on their research in relation to medicinal cannabis. I know, Chairman, from our own conversations and meetings on this and the work of your committee, that you too intend to carry out a body of work at this committee commencing this month. I really welcome that. I think it's extremely complementary to the work that the HPRA is doing, and I know the HPRA will attend at this committee on, I think, the 24th of November. I've asked the Chief Executive of the HPRA that she would also keep this committee up to date with the work that they're doing, so that hopefully the body of work you're doing and the body of work that the HPRA are doing could dovetail, with a view to being in a position in January where collectively we would have the information available to us in terms of the scientific and clinical evidence. I don't intend to dilly-dally in terms of progressing any recommendations in relation to that, but also I don't intend to buy into the myth that we can just snap our fingers and make changes in this regard tomorrow. There is a process that has to go through. The appropriate process is get the HPRA to do its body of work, get this committee to do its body of work. And I know when I spoke to the chairman yesterday, there are a number of other countries which have pursued a course of action in this regard. It may be of use, not dictating your business, but it may be of use for this committee to hear from them. For example, I've written to my counterpart in Denmark this week, where Denmark has changed its policy in this regard on a 4-year trial basis. So I'm very eager to work on a cross-party basis. We will need to work on a cross-party basis if we are to move this forward. And I would see the timeline being that by the end of January we should have a sense of the direction of travel that we could collectively take if people here are so minded to do it.
Thank you, Minister. And Minister McEntee, did you